Hello, Dr. Jenkins and class. I've chosen to do my substance abuse presentation on Delta. Delta has become legal in our communities because of the passage of the Farm Bill in 2018. Hemp was removed from the controlled substance list when this bill went into effect. This legalized THC if it's found at 0.3% or lower. The wording of the Farm Bill contained a loophole which made the unregulated production of Delta actually legal within our communities. The FDA doesn't regulate any production of these products, which is causing increased use of psychiatric care. Regular users have actually stated that Delta 8 is a form that is weaker than Delta 9. Another form of Delta that you may be encountering is Delta 10. Delta 8 has been found in both Delta 9 and Delta 10 due to the lack of regulations on the substance. This means people buying the product doesn't actually know what they're getting. Approximately 76% of the Delta has been found to contain more than the 0.3% of THC, which is exceeding the legal limit. This also is increasing the rates of toxicity. The Midwest and South tend to have higher rates of Delta 8 use. In 2022, 2,362% of 62 cases of Delta 8 were reported. There was an 82% increase in poison control cases in 2022 due to the use of Delta. And of course, a lot of these cases are not reported due to insufficient evidence or additional elements that may be encountered within the process. Some individuals will actually deny the use of it. Approximately 41% of the cases that have been reported includes children under the age of 18 years old, and approximately 70% of these children required some sort of healthcare evaluation. And as we know, the adolescent brain is much more sensitive than the adult brain. Research has stated this for many years. This means that any adolescent or child is at higher risk of developing psychosis or psychotic disorder when they're using Delta. And these products are appealing to some children because they actually think they're buying a normal cookie or gummy. They think they're purchasing candy. There's no established age limit when buying Delta. This is making it easier for small children to make the purchase. Social media and packaging tactics are being used. So overall, anyone suffering from a psychiatric illness, a child, or anyone with a substance abuse issue is more likely to suffer from using the substance Delta and experiencing any medical problems that is created due to this, whether it be physical or psychiatric. In the clinical settings, medical providers have linked Delta and cannabis use to a form of psychosis that is called cannabis psychosis length. You can hear that actually referred to as CPD, which we will get to that specific term further in the presentation. One study concluded approximately 40% of anyone using Delta is at risk for developing psychosis. An additional factor to consider within this scenario is that psychosis is affected by a dose response. This means anyone using Delta frequently can see the risk factors for the development of psychosis anywhere from 40% to 200%. I know that's a wide bracket there. However, research is limited, but there has been significant links to developing psychosis due to using Delta. One study found that approximately 41% of individuals exposed to Delta 8 wasn't unintentional. Again, this is going to be targeting young children, adolescents who think they're actually purchasing candy. And another important note to make is that children exposed to Delta 8 can experience a really high rate of sleepiness, excessive sleepiness, which puts them at high risk for respiratory complications, especially when they're sleeping. This is also increasing the rate of deaths when children are using Delta. At this point, FDA has provided a warning label to the serious health issues being caused by the substance. The DEA has classified Delta 8 as a controlled substance under Schedule 1. And also, household chemicals are being processed and put into the Delta 8. Of course, that's resulting because, there's no supervision of the production of this. Since Delta is relatively new, still on the market, there is limited data and long-term studies teaching us what is the most appropriate medications to treat the issues. However, at this point in time, several different meds have been established. Overall, supportive care and symptomatic care is the best treatment choice for Delta toxicity. Sometimes the patients will need IV fluids, which help flush all these toxins out. Benzos are commonly used in addition to antipsychotics. Warm showers can also be beneficial if there's excessive sedation present. Now, antiemetics are simply not effective for anyone with Delta toxicity. Additional medications that may be used when dealing with this toxicity or withdrawals. Withdrawal specifically includes clonidine and beta blockers can help with anxiety. Pharmacological treatment with psychiatric meds for psychosis includes the mood stabilizers in addition to antipsychotics and, of course, the benzos. Some studies have found that Zyprexa is better tolerated than other antipsychotics when you're dealing with a psychosis disorder related to cannabis use, or Delta, or THC, however you'd like to refer to that. Haloperidol and lurecidone has also been showing positive effects when treating psychosis due to cannabis and Delta. Poison control, of course, should always be utilized as a resource for emergent care, especially when there's a poison related to that's being encountered. The Poison Control Center will have proper protocols to follow that are the most current and up to date within the clinical setting. I see that used very frequently within our psychiatric patients on the unit. Palperidone palmate A, that is another medication injection that is being used, and risperidone and diveloprex is currently being used as well. Of course, there's a wide range of medications, but these are the most common ones that are used. The Zyprexa, the risperidone, the diveloprex, and the injection palperidone palmate. Overall, patient education and supportive care is the best type of health care that can be provided to anyone experiencing issues due to Delta. A comprehensive treatment plan needs to be created so that the recovery process is enhanced. By doing this, relapse rates will be decreased, which will also decrease all of the issues that we are experiencing within our communities due to this, such as psychosis and long-term mental illness that has been directly linked to Delta. Determining the reason people are actually using the substance needs to be evaluated so that the underlying disorder or cause of using the substance Delta can be treated. If we don't know what the problem is, then we can't treat it, obviously. Some studies have stated Delta is being used due to mental health issues such as PTSD, social anxiety, depression, general anxiety. Things of this nature can be helped through therapy. So making referrals to therapy can help, patients develop healthier coping skills, preventing substance abuse issues. This is with anybody at risk for substance abuse or using substances. Students in college may use Delta due to peer pressure. Approximately 42% do it due to peer pressure, while 29% do it to experiment. Approximately 24% of college students are using Delta for pleasure, and approximately 12% of college students is using Delta just to manage their anxiety or stress. Another population that has been using Delta increasingly is pregnant mothers. They are using it to manage their symptoms that they're experiencing within pregnancy. All of these people need to be taught about the dangerous side effects that have been linked directly to Delta. Some non-pharmacological treatments includes hospitalization, of course, non-stimulating calm environment, full psychiatric eval with follow-up psychiatric appointments as needed. This may include long-term medication for psychosis or other mental health issues that are developed after initiating the substance. And then, of course, referrals for different therapists can be completed. And simply educating patients that we encounter on the unit can be done. Every time an assessment is completed and we are aware of them using Delta, we need to educate that patient on the risk factors related to it. We could do local campaigns within our community, or even at a local agency such as a mental health clinic or a substance abuse facilities. We can use these 8 locations to create, little campaigns to educate people. Now, on the national side, if we combined or created a public campaign to where it targets a large number of people in our communities, this would have a significant impact in reducing the increasing rates of Delta use within our communities. Overall, further research is needed related to Delta use and the long-term effects of it. However, at this point in time, there's been a significant amount of negative effects directly correlated with using Delta. Cannabis-associated psychotic disorder, referred to also as CAPD, is the term used for psychosis that's directly linked to Delta or cannabis use. Research on the components of Delta has been found to contain different chemicals such as household cleaners or metal. All of these substances are detrimental on our body, creating a lot of different medical issues. Some of the medicals include mercury, lead, and tin. Another factor to consider within all of this is that the processing of Delta occurs in an uncontrolled environment, which can increase the unsanitary effects or when the Delta is actually being manufactured. Patients need to be educated about the effects Delta can have on their body and on their life. This can be short-term or long-term. Some of these issues encountered include cognitive delays, lower IQs, a motivational syndrome. This is where there's decreased motivation, there's increased isolation, some depression may be present. Now, the acute phase of intoxication includes delirium, psychosis, anxiety, and insomnia. And chronic regular use of Delta leads to basically overall disorganized behavior. Auditory visual hallucinations may be present, paranoid delusions, disorganized speech may be present, impaired learning, memory, and attention. This can be short-term or long-term issues encountered. And of course, violence, increasing rates of violence are occurring with these patients due to the increased agitation and paranoia and delusions, that sort of thing. And some other side effects include loss of consciousness, vomiting, tremors, confusion. Some of the physical side effects include a cough, a rapid heart rate, anxiety, breathing issues, and seizures. And the potential for overdose on Delta is relatively high due to the way it's manufactured and the way it's not monitored, because you can have excessive levels of THC in the product. You're supposed to have 0.3 or below to be considered legal, I should say. However, evaluations on when they went in and actually analyzed the components of Delta, many of them have found, increasing rates of THC in it significantly above the 0.3, which is increasing, the overdoses and suicide rates due to this. They become toxic and is not aware of what they're doing and what's going on in their environment, which is increasing the death rates and suicide rates. So people need to be taught about the long-term use of THC and Delta, which can lead to different types of cognitive dysfunction. And these cognitive dysfunctions that occur may or may not be reversible, even with absences from the drug. Another important factor to consider is that anyone who has been diagnosed with mental health conditions that already have psychosis, or psychosis can occur due to the mental health condition when it's not under control. Using Delta with these psychiatric conditions can worsen that health condition even further. For instance, someone with schizophrenia, they're on antipsychotics and they choose to use Delta. Well, while they're using this Delta or after they've stopped using the Delta, this increases the effects of that mental health condition. It can deteriorate even quicker at a faster rate due to using the substance. And another thing is that using Delta while they're taking antipsychotics can actually decrease the effectiveness of the antipsychotic that's being used. Increased hospitalizations and suicides and overall death rates are increasing due to all of these factors. Altered brain development may occur, cognitive impairments may occur, poor educational outcomes are occurring, increased likelihood of children dropping out of school, lower intelligence rates are occurring. Individuals who chronically use Delta or cannabis are at higher risk of developing these cognitive and psychomotor driving impairments than someone who uses it on a short-term basis. We must educate our patients on all the neuropsychological impairments they may result, including reduced executive function, reduced ability to concentrate, and reduced ability to remember new facts. So the signs and symptoms of abusing Delta is basically the same as the short-term effects, and long-term effects may be seen when they're actually abusing this. When you're doing that assessment, you may find psychosis, you may see the paranoid delusions, you may learn about the auditory hallucinations or the visual hallucinations. Of course, we can see the violence and aggressive behaviors that are present in these patients. Education should be provided at school, at home, and on outpatient clinics to improve behavioral issues that can potentially lead to using substances such as Delta. A full psych assessment for comorbidities such as mental health disorders that have been linked to substance abuse issues. This may include PTSD, depression, sleep issues. Some of the things that can be provided, referrals can be made for this, includes therapy, cognitive behavioral therapy in particular, multidimensional family therapy. All of these types of care, psychiatric care, can help decrease the issues that's being encountered within our communities. So as a referral to counselors, a full psych assessment needs to be completed. Anyone using Delta due to chronic pain needs to have an appropriate referral made for neurology or a pain management clinic. Sometimes both are needed. Then, of course, you've got individuals who's using Delta due to insomnia. Sleep studies can be beneficial for these patients. Whatever this patient is doing, whatever is causing this patient to use Delta needs to be determined so an appropriate referral can be made so that the medical issue can be treated properly, decreasing the use of Delta. So the follow-up care for abusing Delta includes following up on patients who have been referred to substance abuse programs, whether that's intensive outpatient or inpatient programs that may be used, especially if they've had a long-term drug history. If they've been referred to a pain clinic, a follow-up needs to be provided on that. Providers need to assess if the pain has been properly dealt with. If they're referred to neurology, of course, that needs to be followed up on as well. Then, of course, anyone that's referred to have a sleep study completed due to insomnia, that also needs to be followed up on. Any health condition that may be leading to the use of Delta needs to be followed up on. It needs to be managed appropriately so that these individuals are not going to continue using Delta. So as time keeps progressing and the increased use of Delta is occurring within the clinical setting, within our communities, more and more side effects are being encountered in the clinical setting. So far, medications, when they are combined with Delta, this can increase the side effects or adverse effects significantly. An online tool has been developed for clinicians so that they can evaluate the patient's medications and Delta if they are used at the same time. For instance, Delta, when it's combined with a blood thinner, can alter the effectiveness of that blood thinner. It may decrease bleeding time or increase that bleeding time. And this can lead to many different issues for someone that's suffering with medical problems related to all of that. And some psychiatric meds have also had issues when it's combined with Delta. Some of the antipsychotics can be increased within the patient's system due to it working on the cannabinoid receptors located in the brain. If an antipsychotic is targeting those receptors and then you use Delta, then it can actually block those receptors, causing a toxic level of that antipsychotic. This is something clinicians need to be aware of so that it can be prevented. The tool that has been created to help identify potential drug-to-drug interactions can be found at the website www.cann-dir.psu.edu. So, as I've stated throughout this presentation, Delta is legal. However, just because it's legal doesn't mean it's not an issue within our communities. A variety of mental health issues or conditions are being increasingly encountered due to the substance. Short and long-term effects are occurring related to mental health disorders. Just because it is something that occurs briefly, if you continue using the substance, you have an increased risk factor of developing the issue on a long-term basis, such as psychosis, all of the cognitive issues that is created by using Delta. Adolescents are at a higher risk than anyone else of developing psychosis, which needs to be relayed to the general public. In addition to this, adolescents have a higher risk factor for experiencing suicides and deaths because of the substance and their immature ages. Pharmacological and non-pharmacological treatments must be encouraged to decrease the overall negative effects of Delta within our communities. Appropriate referrals must be completed along with needed follow-up care. Public education must be provided on a local and national level to decrease the detrimental effects that is being encountered due to the substance of Delta. Advocating for the removal of Delta, making it illegal, would help overcome all the issues within society that is caused by using this legal substance. It will decrease the rates of Delta being used within the community. Thank you everyone for listening, and have a great day.